anesthesia team here, and I'm going to be doing your initial assessment. How are you doing today?
I'm doing good.
Good. Okay. Good. So just before I can start out, could I please confirm with you your name and date of birth?
Perfect. My name is Juan Carlos Cortez, and my date of birth is October 11, 1996.
All right. Wonderful. And could you tell me what brings you in today?
So I've been having wrist pain, so they're going to do an arthroscopy on me today on the right wrist.
Okay, so they're going to do an arthroscopy of the right wrist. Do you understand what that is? Do you understand what's going to be happening
Yes.
when they do that procedure? Okay, wonderful. Okay, so this wrist pain you're feeling, could you tell me when it started or what kind of happened when you first noticed it?
It started about a month ago, and I was painting my house, and then suddenly I just got this like intense, very sharp pain.
Okay, and is there anything you do that makes it worse? Anything that you do that alleviates it? What aggravates the pain in your wrist?
When I put ice on it, it gets a little better. But whenever I move my wrist like up and down, it makes it worse.
Okay, and could you describe the quality of the pain? Is it a sharp pain, an aching pain, a burning pain? How would you describe it?
It's not necessarily a burning pain. I would say it's more of a sharp pain.
Okay.
Like only with movement, so up and down it like feels very sharp. But if I leave it still like this, it really goes hurt.
Okay, and in what region do you feel it specifically in the wrist? And does it spread anywhere? Could you identify exactly where the pain is located?
It's mostly on top, and then it spreads like up my arm about to like here, like mid-arm, when I move it. But other than that, it's pretty localized whenever I
Okay, and is it the same sharp pain all over your arm here?
Yes, a little sharp pain here, a tiny little bit of burning at the end, but that's pretty much it.
Okay, and so could you tell me about the severity of the pain on a scale of 1 to 10? 1 being not so bad, 10 being the worst pain you've ever experienced in your life.
I would say, I mean, it's not bad, it's just uncomfortable. I would say maybe like a 5.
Okay.
So kind of like in the middle.
Okay, and is it a constant pain? Does it come and go? What's the timing of it, would you say, if you could describe that?
It's like a 2 constant, and like I said, whenever I move it, that's when it becomes like a 5. But it's there pretty much all the time.
Okay, got it. Okay, so now that I understand what's going on with your wrist, I want to ask you about any medical history. Do you have any previous medical conditions, maybe hypertension, diabetes, hyperthyroidism, anything like that?
No real like background history. The only thing that I have is a little bit of hypertension, but I control it with my medications. Other than that, no real history. I feel like I'm pretty healthy with it.
Okay, cool. So could you tell me a little bit more about those medications? What medications is it that you take for your hypertension?
I just take lisinopril. I don't remember the dose right now, but that's all I take. And I took it this morning.
Okay, and how often do you take it? Do you take it once a day, twice a day?
Just once a day.
Okay, I'll be able to look up the dose in your chart there. And then how are you with taking it? Do you take it regularly? Do you forget some days? You can be totally honest with me.
No, I take it every day. I'm pretty good about it. Since that's the only medication that I take, that I'm pretty good about taking my medication every day in the morning.
Okay, awesome. All right, so just hypertension, you take lisinopril once a day.
Yes.
Okay, and have you ever been hospitalized previously? Had any accidents or traumas in the past?
No hospitalizations. I mean, maybe like 4 years ago for COVID, I was hospitalized, but that's really the only thing that I've ever had. Other than that, I've been pretty healthy. I've been trying to stay healthy.
Okay, so you've been hospitalized once for COVID, and that was 4 years ago, so that was in 2021?
Yes, correct.
Okay, and that's the only hospitalization you've ever had?
Yeah, pretty only hospitalization I've ever had.
Okay, and so have you had any previous surgeries?
Not that I can recall. I got my tonsils removed years ago.
Okay, about how long ago was that?
Wow, maybe like 12 years ago I got my tonsils removed.
Okay, so about 12 years ago, so that would be about 2013 you had a tonsillectomy.
Yes.
Okay, wonderful. Okay, so you mentioned that you had had a tonsillectomy in the past. Do you happen to remember what type of anesthesia they performed for you? I totally understand if you don't remember, but was it general anesthesia, IV sedation? Do you have any idea what it was that they used for you?
I just remember that they completely put me to sleep. Like I was completely out. That's what I remember.
Okay, do you know if you were intubated while they did this?
Yes, they did mention that they had to intubate me for this.
Okay, so that means you probably received general anesthesia. Okay.
Yes.
No, you remember that you were intubated? Do you know if they told you that you were difficult to intubate? Was there any problems with the intubation?
No, I don't recall them saying that I was difficult to intubate or anything like that. From my understanding, I was pretty easy and everything was smooth.
Okay, so did you remember if you had any awareness under anesthesia? Did you wake up at all or anything like that?
No, I actually don't remember the surgery at all, so I don't think I had any type of awareness or anything like that.
Okay, and then after the surgery, like when you were in the recovery, did you have any nausea or vomiting or anything? Do you remember?
Yes, I remember. I didn't actually vomit, but I remember I was feeling really nauseous after the procedure. So, but I think they gave me something for that afterwards, and then I ate.
Okay, so you did have some post-op nausea. That's okay. We can handle that fine. And then, do you remember if they told you that you had any delayed emergence from anesthesia? Did it take a while to wake you up? It sounds like it was pretty normal, but do you remember them saying that it took a while to wake you up or anything?
No, they didn't tell me anything about that. From what I remember, everything went smooth, and I was able to wake up pretty rapidly from the procedure.
Okay, wonderful. And if you said that was the only surgery that you've ever had.
Yes.
So, besides of your anesthetic history, I'd like to ask you about any family anesthesia history. Do you have any family members that have any history of problems with anesthesia that you can think of?
Not off the top of my head, no.
Okay, so have you never heard any of your family having hit problems with malignant hyperthermia? Maybe does that name ring a bell?
No.
What about pseudocholinesterase insufficiency?
Nope.
Anything like that? And what about any allergic reactions to anesthesia?
No allergic reactions, and I'm not allergic to anything, so.
Okay. Okay, so I heard you say that you're not allergic to anything. You're sure you don't have any allergies at all? Any intolerances or anything?
I'm not allergic to any medication, but I am allergic to mushrooms.
Oh, okay. So you are allergic to mushrooms.
Yeah.
And what kind of reaction do you have when you consume mushrooms?
I just get hives, but nothing respiratory, just hives.
Okay, so just hives in reaction to mushrooms.
Yeah.
Okay, got it. All right. Now I'll ask you a little bit about your social history. Are you a smoker, or did you used to smoke?
I used to smoke maybe 7 years ago, and I just drink socially.
Okay, all right. So, and when you say you drink socially, about how often do you drink, and how much do you drink?
I would say every other weekend, and if I go out, I have maybe 4 or 5 beers.
Okay, so about 4 or 5 beers every other weekend.
Yep.
Okay, and back when you used to smoke, how much did you smoke on average?
A pack a day.
A pack a day?
Yeah.
And how long did you smoke a pack a day for?
Maybe for 3 years.
Okay, so 3 years for a pack a day. Okay, understood.
Yeah.
Do you use any recreational drugs, any IV drugs or cannabis or anything like that?
No, none of that.
No? Okay, and then could you tell me, what do you do for work?
I actually am a teacher at school.
Oh, okay, wonderful. And so you work inside, is it an outdoor school? Tell me about your work environment.
It's inside. I always work in AC, so don't do any type of heavy lifting or anything like that.
Okay, and how many days a week do you work?
5.
And you have the summers off?
Yep.
Any other jobs over the summer, or just only a teacher?
No, that's it. And the thing that happened with my wrist was because I was working on my house, but other than that, just a teacher.
Okay, wonderful. All right, now I'd love to ask you about your family history. Do you have any health conditions that your parents have? I know you said you have hypertension. Do they also have hypertension? Do they have anything else?
So pretty much everybody in my family has hypertension, and then my mom has diabetes, and then I think that's pretty much it. My grandma had cancer, breast cancer, but other than that, that's pretty much it. So hypertension, diabetes, and then my grandma had breast cancer.
Okay. Do you have any history of heart disease among any of them, other than hypertension? Has anyone had any clots or anything inside their system? Okay.
Nothing like that.
And so you said your mom has diabetes. Anybody else have diabetes?
My mom and my dad have diabetes.
So both your mom and your dad have diabetes.
Yeah.
And then what about has any of your family ever had any strokes?
No strokes.
Okay, what about any renal disease? Is anybody on dialysis or anything?
No, nobody's on dialysis in my family.
Okay, got it. Now I'm going to go ahead and assess your airway, all right? First thing I'm going to do is take a Mallampati assessment of your mouth, okay? So could you go ahead and open your mouth for me and stick your tongue out as far as you can? Okay, I'm able to see the base of your uvula and both peritonsillar pillars, so therefore you have a Mallampati of 1. Okay? Now I'm going to assess your thyromental distance. If you could just extend your neck just a little bit, I'm going to measure the distance between your thyroid and your mentum, and you have about 3 finger breadths, so that is normal. Now I'm going to assess your mouth opening. If you could just go ahead, don't stick your tongue out, but open your mouth as far as you can. All right, I'm going to see how wide. I see you have at least 3 finger breadths between your 2 teeth, so that is normal. Now I'm going to go ahead and assess your teeth. If you could just smile for me. All right, I'm taking a look at your incisors, and I see that they are not protruding or anything like that, so that is normal. All right, now I'm going to assess your atlanto-occipital joint mobility. So the way I want to do that is if you could just go ahead and slowly extend your neck all the way up and all the way down while I observe how well you move. Okay, so go ahead, extend all the way up, and flex all the way down. Okay, yep, your atlanto-occipital joint mobility is perfectly normal, all right? Now I want you to go ahead and I want to look at your neck mobility. If you could go ahead and turn your neck from side to side like that.
Like this?
Yep, just like that. That's perfect. All right. All right. It looks like you've got perfectly normal neck mobility. Okay.
Okay.
Now I'm going ahead and want to ask you if you've had any difficult intubations in the past. I know you stated before, but just in order to keep us consistent, I want to make sure we are going through the whole airway assessment. So have you had any difficult intubations in the past?
No difficult intubations in the past. I said I was pretty smooth to intubate. So.
Okay, wonderful. Then I'm going to go ahead and tell you that you are going to be you have all the signs for a non-difficult intubation. Everything should be normal. Okay.
Okay, perfect.
Okay.
That's amazing news.
All right. So now, just wanted to go over with you the fact that there is going to be a risk of damage to your teeth while intubation. Okay, that's something very strong. So you understand that there is a risk of damage to the teeth.
Yes, I understand.
Okay, perfect.
Hopefully not, but yes, I do understand.
Okay, now I'm going to go ahead and take some vital signs on you. Okay, so you already told me your birthday, but could you go ahead and tell me how old are you? What is your age?
I am 29 years old.
Okay, so your age is 29 years old. All right, now I'm going to go ahead and start taking some vital signs on you. I'm going to do that by taking your blood pressure here. You can go ahead and raise your arm here for me. Okay. Just going to roll your arm up. Now, while I'm taking your blood pressure, if you could go ahead and sit up straight, make sure that your legs are not crossed.
Okay.
And just breathe normally for me, okay?
Okay.
Go ahead and relax your arm here. Okay. Now I'm going to go ahead and take your pulse on this arm, on this finger, okay?
Okay.
Okay. All right. So your pulse rate is at 80. I measured your respirations too, and you're breathing at a rate of 14 breaths per minute. Your blood pressure is 133/88.
Okay.
Okay. All right. So now we got those.
I took an energy drink, so that's where it may be a little high.
Yeah, that could definitely account for it. Okay.
Okay.
All right. Now I'm going to go ahead and measure you. So if you could go ahead and stand up straight for me, so we can get your height. So
Okay.
I'm going to put this here at the. We're going to put this here at the bottom. Put this here at the bottom of your. Put this here at the bottom of your foot and hold it up so we can get your height. Okay.
Okay, perfect.
Thank you. Step down. Okay, you are exactly 69 centimeters, so 5'9". Perfect. And now let's go ahead and get your weight here.
There we go.
Okay, and your weight is 183 pounds.
Perfect.
We want to go ahead and we'll be using that in kilograms. So you're 183 pounds. Means you are 83.2 kilograms. Okay? All right. Now I'm going to go ahead and assess your skin. Just going to take a look at your skin here and assess the turgor of your skin here. You see your arm over here. Okay, assess the skin back here. Okay, so you appear well developed. You appear to have appropriate turgor. Your skin is dry and warm, so I do not see there's no rashes or lesions anywhere, so your skin appears very normal right now. Okay, now I'm going to go ahead and do a head, ears, eyes, nose, and throat examination. Okay. So first I'm going to check your head and your scalp for symmetry. Everything feels pretty symmetrical right there. I don't feel any masses or bumps or anything like that. Okay. Now I'm going to go ahead and take a look in your eyes. Okay. Your eyes are equal, round, and reactive to light. Okay. I see you have a normal color of your sclera, and I see that your pupils are normal and they're both equal. Okay. Okay. Now I'm going to go ahead and inspect your ears. Okay, now, the way I'm going to check your hearing is I'm going to rub my fingers together next to your ear. Tell me when you start hearing it, okay?
Okay. Now. Now.
Okay, perfect. All right, now I'm going to go ahead and take a look at I see that your ears appear normal on the outside, and that is a normal amount of hearing, okay? Okay. So now I'm going to go ahead and inspect your nose. Feel that for any lesions. Okay, your nose is normal to palpation. I see that you have a normal septum, no deviation there, and there's also normal mucosal color there in your nose, okay? Now I'm going to go ahead and inspect your mouth again. Go ahead and open your mouth for me. Go ahead and say ah. Ah. Okay, I see that your mouth is normal coloration. The mucosa is all moist. I don't see any lesions or any types of discoloration, and I see normal uvular rise, okay? So right now I'm going to go ahead and palpate your frontal and maxillary sinuses. Any pain or anything when I feel there?
No.
No? Okay, once again, I do not feel any lesions. There's normal coloration. I do not see any issues. So overall, I would say your head is normocephalic, atraumatic. There's no signs of any damage or trauma. Your pupils are equal, round, reactive to light, and then you have normal eye movement. Your sclera are clear. Your conjunctiva are pink. Ears look normal. The nasal mucosa looks normal. Your oral mucosa is moist. And you have good dentition. The uvula is midline and symmetrical, and there's no sinus tenderness. So very normal head, ears, eyes, nose, and throat evaluation.
Thank you so much.
Okay, now I'm going to go ahead and do a respiratory system evaluation on you. So if you could just go ahead and lean forward in your chair a little bit, I'm going to inspect how your chest rises. Go ahead and take some nice deep breaths for me. Okay, I'm viewing symmetrical chest rise. Now I'm going to go ahead and palpate how your chest moves. Okay, I'm feeling symmetrical chest rise posteriorly, no tactile fremidus. I'm going to go ahead and palpate on the sides here. Feeling symmetrical chest rise laterally, no more tactile fremidus. And symmetrical chest rise anteriorly, no tactile fremidus. Okay, now I'm going to go ahead and do some percussion on all the sides. Make sure everything sounds normal. Everything sounds normal posteriorly. Now let's do laterally. posteriorly. Okay, everything sounds normal. So now I'm going to go ahead and auscultate. So if you could just go ahead and breathe the same thing you've been doing, just going ahead and breathe normally.
Okay.
Now I'm just going to go ahead and auscultate back and forth in a Greek key pattern to the different bases of your lungs. Go ahead and breathe normally. Okay, now if everything sounds good posteriorly, now I'm going to auscultate anteriorly in that same Greek key pattern. Okay, everything sounds normal, more normal from that respect. Okay, now I'm going to go ahead and do a cardiovascular assessment. First, I'm going to inspect the precordium area to see if I see any types of striations or extraneous movements. Okay. There. Now I'm going to palpate at the PMI, or the point of maximal impulse, to make sure that I feel your heartbeat normally, and I do. Okay. Now I'm going to go ahead and auscultate all the different heart areas. All right. So first, I'm going to auscultate the aortic valve at the second intercostal space at the right sternal border. Then I will auscultate the pulmonary valve at the second intercostal space left sternal border. Okay. Then I will auscultate Erb's point, which is at the third intercostal space left sternal border. Then I auscultate the tricuspid valve at the fourth intercostal space left sternal border. Then I auscultate the mitral valve at the fifth intercostal space mid-clavicular line. All right, and all those valves sound normal to me. Now I'm going to go ahead and do your GI system evaluation. So first I'm just going to inspect the abdomen for contour and symmetry. Okay, now I'm going to auscultate all four quadrants. I will do this before I palpate, so it doesn't negatively impact the auscultation. Okay, all that sounds normal. Now I will go ahead and palpate. First palpating lightly and then deeply. Do you feel any tenderness there when I palpate?
No.
Okay, I see that the abdomen is flat and symmetric. Vital sounds are active in all four quadrants. There is no type of tenderness or anything like that. No organomegaly. So everything seems pretty normal to me.
Perfect.
Okay, now I'll go ahead and do a musculoskeletal assessment. If you could go ahead and stand up for me. All right, I'm seeing that you have normal posture, and if you could go ahead and move your shoulders for me. Could you move your arms? Okay, could you raise both legs? All right, I see that you have normal joint mobility. Is there any type of, just let your arms relax for a moment. Do you feel any type of tenderness when I move those?
No.
No? Any type of tenderness here?
No.
Okay.
Just my wrist.
Yes, just the wrist. Okay. So I'm gonna go ahead and assess your reflexes here. Okay, that's normal. Assess your reflexes here. Okay, that's normal. Now if you can go ahead and sit down for me. Okay. Go ahead and let your arm hang loosely here. Go ahead and assess your reflex here. Okay. Go ahead and assess your reflexes here. Okay. All right. And you know no tenderness or anything in any of your joints other than your arm.
Yes.
Okay. Got it. Okay. I would say you have normal posture and gait, full range of motion in all of your body parts, and more normal strength and balance. Okay, now I'm going to go ahead and do your endocrine evaluation. So I'm checking for your skin and hair distribution, and everything looks pretty normal to me. I'm going to evaluate your thyroid for enlargement. Any tenderness here when I feel that?
No.
No? Okay. Can you go ahead and swallow for me? Okay, all right. I don't see any exophthalmos, no tremor. The thyroid is midline and not enlarged. There are no palpebral nodules, and everything moves normally while swallowing. There's normal hair distribution. Okay. Now for your peripheral vascular evaluation. So I'm observing for any bruising or petechiae. I do not see anything there. I'm going to palpate your pulses. Pulses feel normal. Now if you could go ahead and take off your shoes so I can assess your pedal pulses.
Yes.
Pedal pulses feel normal. Now I'll go ahead and assess your capillary refill. Capillary refill is less than 2 seconds, therefore that is normal, and I do not feel any edema anywhere either. So I would say you have a normal peripheral vascular assessment. Your pulses are palpable, normal, no edema, and no extraneous bruising. Okay, now I'm going to go ahead and do your endocrine evaluation. So I'm checking for your skin and hair distribution, and everything looks pretty normal to me. I'm going to evaluate your thyroid for enlargement. Any tenderness here when I feel that?
No.
No? Okay. Can you go ahead and swallow for me? Okay, all right. I don't see any exophthalmos, no tremor. The thyroid is midline and not enlarged. There are no palpebral nodules, and everything moves normally while swallowing. There's normal hair distribution. Okay. Now for your peripheral vascular evaluation. So I'm observing for any bruising or petechiae. I do not see anything there. I'm going to palpate your pulses. Pulses feel normal. Now if you could go ahead and take off your shoes so I can assess your pedal pulses.
Yes.
Pedal pulses feel normal. Now I'll go ahead and assess your capillary refill. Capillary refill is less than 2 seconds, therefore that is normal, and I do not feel any edema anywhere either. So I would say you have a normal peripheral vascular assessment. Your pulses are palpable, normal, no edema, and no extraneous bruising. Now I'm going to go ahead and do our neurological and psychological assessment on you. Now, I know I already asked you this before, but could you tell me your full name and date of birth?
Yes, my full name is Juan Carlos Cortez, and my date of birth is 10/11/1996.
Okay, thank you, Mr. Cortez. And you tell me where we are right now, Mr. Cortez.
We're in the hospital.
Do you know the name of the hospital?
Manatee Medical Center.
Perfect. And do you know what year it is?
It's 2025.
And who is the president?
Donald Trump.
Okay, and if I were to take a rock, like pick up a rock off of the side of the road and throw it into water, would it float?
Nope.
Okay, wonderful. All right, so now I'm going to go ahead and ask you to smile for me. Okay, can you go ahead and shrug your shoulders? Can you follow your eyes with your finger with my eyes? Okay, and now could you go ahead and count to 10 for me?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, now could you do what weighs more, 1 pound or 2 pounds?
2 pounds.
Okay, why not? Now, could you go ahead and reach out and touch my finger with that hand? Reach out, touch my finger with this hand. Okay, can you touch your finger to your nose? Touch your other finger to your nose. Now hold out both your arms for me and just hold them straight. Okay, could you go ahead and squeeze both my hands for me? Now, could you pull your feet up against my hands and press like you're driving a car? Okay, wonderful. All right, I see that you are alert and oriented ×4. You have intact eye movement. You have equal hand strength and foot strength. So I would say you have a normal neurological psychological evaluation.
Perfect.
Okay, Mr. Cortez, this will go ahead and complete my evaluation, your pre-surgery evaluation. So I think we are already good to go, and we'll be able to get your wrist taken care of now. Thank you so much.
Perfect. Let's go.